prevention, and I'd say slash treatment. These are the things you should be doing both to treat the carpal tunnel syndrome and also to prevent it. They're really the same, they fall in the same family really, so.
Right.
Do you want to start talking about wrist brace? Is that what you're going to talk about?
Yeah, actually, oftentimes people with carpal tunnel, as a matter of fact, not too long ago I was talking to a surgeon, and that's what he specializes in, is from the elbow down with carpal tunnel. And he says one of his first things he does is have people that have carpal tunnel syndromes is to use a night splint, okay? These actually are night splints that my wife wears, and she's had carpal tunnel symptoms for a number of years. If she wears these at night, throughout the night, it really cuts down on her numbness and tingling. It makes the symptoms throughout the day better too. So,
and one of the theories is the reason is because a lot of people do sleep with their wrists flexed at night.
Right, like this.
Yes, or like this, yeah. So I mean, it's in an extreme position, and you stay in that position for a long time.
I don't know if we mentioned it, but that out of neutral position is like a garden hose, and you crunch it.
That's a good way to describe it.
So you just, if you think of putting your wrist like that, it takes those tendons and that median nerve and puts that crunch on it. Okay.
Especially when you do it for a long period of time.
Exactly. So that's why we have these at night. Don't tighten them too tight. You don't have to have a special wrist splint. You have to have a comfortable one. That's the most important thing, and one that maintains that neutral position.
You can get these splints almost anywhere.
Yeah, they're very common.
Drugstores.
You can wear these at work as well. The idea is that it's going to keep your wrist in a neutral position while you're working. So if you got the drill here and you're working, it reminds you to maintain that neutral position. You're never going to have a wrist splint so tight and so rigid that it doesn't allow, you have to have movement in your wrist. But it'll keep you in that neutral position more often than not.
Exactly.
And that's what's critical. So I like these DeWalt's bombs. They're nice drills. I got a Milwaukee, but I think we should stick with these DeWalt's.
And so we digress. Okay, let's talk about what else. Stretching. Are we going to go into stretching?
Right, absolutely. Right. And this is a real preventative one that you can do to prevent.
Preventative, but I have also, in fact, I'm going to be seeing a patient with carpal tunnel syndrome tomorrow. And this is one of the main things I'm going to be going over with her is that we've got to stretch things out to keep those nerves, give them plenty of opening to go through underneath the clavicle, into the arm. Keep it stretched out here. Even the muscles here can tighten down on the nerve. And, so, do you want to start talking about some of the stretches, Brad?
No, you can.
All right, well, let's talk about cervical extension is one. I just sitting in a nice straight back chair. I like to have them go and I don't know if I have to do tuck-ins or not, but at least have them work on going back like this. Good, repeat at least 5 to 10 times.
Yep. And this is an exercise that I hear people say, you're not supposed to do that with your neck. You can hurt yourself, and it's far from the truth. I mean, if you do it and you get sharp pain with it, you've got a problem in your neck and you shouldn't do it. But if you're doing it, it should be fine.
We generally find out that this is one of the best exercises you can do for your neck, and this really starts to open things up here. So how do you normally have them stretch here?
In here, typically, like in the computer workstation, if they're working there, I'm just talking about bringing scapular retraction.
Or you can even go like this with the arms.
Right. But if you got someone sitting next to you, you hit them in the head, it's not good for the worker.
Or like this.
Right, there you go.
But all this stretches the chest muscles and leaves more room for the nerves to go through.
Right.
So these are really what I would say 2 critical stretches to do.
Right.
I would really make sure that they're part of your repertoire.
Sure.
Do you want to show the wrist stretches?
The wrist stretches I like to recommend. They're simple and they're easy. The first one is the extensor, the wrist extensor. Now this is not an aggressive stretch where you're really pulling hard, but you bring your hand up like this.
The elbow is straight.
Elbow is straight. Don't go up on the fingertips. Go at the palm or where the fingers meet the palm right here, and just gently stretch there. And you don't hold it for 30 seconds. You just hold it for a few seconds. And this is something you can do throughout the day, every 20 minutes or so, and do both hands. Some people like to do it this way. It's a little more aggressive that way. Okay, and the next one, which stretches the muscles up here, you go down like this and rotate out. That actually is not specifically for the carpal tunnel, but it helps loosen up the wrist in general, which is good for it. And it's down and rotate, okay?
Exactly.
Shake it out, relax the shoulders. Posture in the chair is always
It's critical. A good reminder then right after you do your stretches to recheck your posture and make sure that you're keeping good posture no matter what you're working on.
Get up tall, chin in, as opposed to this.
Exactly. All right. What else do we need to talk about?
we can talk about the Brewers. They lost last night. Okay, and finally, in the worst case scenario with carpal tunnel syndrome is nothing is working with your prevention and your treatment from the therapist, etc., and it's time to go to the surgeon to have surgery. And if you look right here, we talked about that transverse ligament that connects and completes the tunnel. They literally make a little incision on your wrist. It's only 1 inch, inch and a half long, and they cut that ligament, opens up the tunnel so that there's not so much pressure on that median nerve. They sew it back up, and within a couple of weeks you're doing pretty good again. Success rate on that is not 100%. You need to talk to your surgeon about that, and they should provide you with some percentages of what they expect for success on a carpal tunnel with your problem.